Hello everyone, this is Dr. Tushar Mehta. I'm an orthopedic surgeon in your faculty of orthopedics. Well, I'm sure by now you must have seen this MCQ on your screens. Anterior dislocation of the shoulder is likely to result in damage of which of the following nerve? Four options, and I'm sure by now you must have guessed the answer as well. It is axillary nerve. See, you need to understand that there is a circumflex branch of the axillary nerve which makes a loop around the surgical neck of the humerus. And when we talk about shoulder dislocation, particularly anterior shoulder dislocation, the moment we do abduction and external rotation, this part gets stretched, and injury to circumflex branch of axillary nerve is a very commonly seen complication. I would also like to add that in anterior shoulder dislocation, overall most common complication is recurrence. But is that an immediate complication? No, that's a delayed complication. So overall most common complication of shoulder dislocation, recurrence. Most common delayed complication of shoulder dislocation, recurrence. What will you call the most common immediate complication as? The one that is on your screen right now, injury to circumflex branch of axillary nerve. I would like to use this opportunity to tell you people that in fracture of the proximal humerus, primarily surgical neck of the humerus, the most common nerve injury is surgical. Around the surgical neck of the humerus is circumflex branch of axillary nerve. The most common nerve injury in fracture shaft of humerus in radial groove, because everybody knows that on the posterior surface of the shaft of humerus we have radial nerve coming down in the radial groove between the two heads of triceps. That's a common nerve injury in the fracture shaft of humerus. In the distal end of humerus, if you have a supracondylar fracture humerus, I'm sure you'll be able to remember that the most common nerve injury is anterior interosseous nerve, which is a motor branch of median nerve. If you have a fracture of the lateral condyle of the humerus, you will have ulnar nerve, or if you have an injury directly to the medial epicondyle, then also you will have ulnar nerve injury. So bottom line remains the same. In proximal humerus, surgical neck of humerus, circumflex branch of axillary nerve, shaft of humerus, radial nerve, distal end of humerus, on the medial side ulnar nerve. Even in the fracture of the lateral condyle, because of this continuous valgus ulnar nerve, supracondylar fracture, anterior interosseous nerve, which is a motor branch, deep motor branch of the median nerve. I hope you got this MCQ clear, along with its explanation and along with other possible MCQs as well. Please like, share, and subscribe to the YouTube channel. Thank you.